gathering information can be very tedious and stressful and tying into your own psychology and your own recovery and that environment that you're putting yourself into. I'm a very I love positive psychology. Surrounding yourself with positive people and a positive care team is a very strong factor in just absorbing the right information.
There is no one pituitary tumor, but what is clear is that the pituitary gland, which is a very small organ, it's called the master gland, sits right between the eyes, can be afflicted by certain types of growth, just like any tissue in the body. But over 90% of those tumors that grow in the pituitary gland are of the benign type, meaning they don't metastasize and go to other places. But they can cause problems because if they grow to be a certain size, there are lots of other critical structures that are in that area that can cause symptoms. So for instance, both of the nerves from your eyes cross in the center and meet right above the pituitary gland. So if a growth, a cyst, grows to be large enough, it can compress the chiasm and cause visual deficits, which is a very common presentation of someone that has a pituitary tumor. Pituitary tumors are indeed incidental and don't cause any symptoms. And it's typically that when they grow to be a certain size, that they can affect the other structures around there that they become symptomatic. And so some pituitary tumors are actually tumors that secrete hormones that would normally be present in the gland. And when they secrete those hormones can have a variety of effects on the body. So there's some tumors that secrete ACTH, which is a hormone that can stimulate the adrenals to create cortisol. And that can have a variety of effects on the body. It can cause people to gain weight. It can cause acne. It can cause them to develop what we call a moon face, which is a round face with red cheeks. It can cause people to be fatigued. It can lead to cardiac problems and hypertension and diabetes. And these are all the symptoms that can develop from ACTH secreting tumors. There are other tumors that secrete growth hormone, and that can lead to a variety of effects on tissues that come from growth hormone excess. For instance, if there is a patient that has not yet reached puberty, they can become a giant, and we've seen some of those instances in NBA players. If it's a patient that has already reached puberty, then the effect is acromegaly, which means that their bone and skin become large and with coarse features, and that can also affect the heart and lead to reduced lifespan. There are tumors that secrete prolactin, which is actually one of the more common secreting tumors, and that can have a variety of effects on individuals. Women can become infertile, they can release milk production with the breast, men can have issues with infertility as well. And then there's a category of tumors that don't secrete anything, or at least if they do secrete something, it doesn't tend to have the same type of effects on the body as those other types of hormone-secreting tumors. And with those tumors, usually the first time they become evident is when they become large enough that they actually press on the optic chiasm or some of the cranial nerves that are also in the space next to the pituitary gland. We don't know what causes pituitary tumors. There are some rare families that tend to develop multiple tumors in different glands. And in those particular individuals, they do have an increased risk for developing pituitary tumors. But the vast majority of people who have these, it occurs sporadically. So one of the great things about Stanford is that we have a comprehensive pituitary center. And what that really means is that we have a variety of experts that are able to provide consultations on all the things that could potentially need to be evaluated in someone that has one of these types of lesions. So for instance, everyone who comes to our pituitary center gets a comprehensive evaluation by a medical endocrinologist and also a pituitary surgeon. And depending upon their symptoms, they also get an evaluation by a neuro-ophthalmologist and will require some types of medical imaging, which will either be an MRI scan, a CT scan, or sometimes even other types of imaging that will be necessary. And so, as you can see from all those different specialists that are involved and tests that need to be done, in order to make the right diagnosis, to give the best possible treatment algorithm, sometimes it takes time to move through all those things that need to happen. It's important that when you're evaluating a patient who has a pituitary lesion, that you get a very thorough history, which includes some sense, not only their family history, but the history of birth, how they've been in terms of their vision and other medical history throughout their life. And then when they start to get their symptoms and exactly what those symptoms are. So for instance, is there any excessive weight gain or weight loss? Is there any sensitivity to heat or cold? Is there any change in the hair, nails, or skin? Is there any excessive thirst or urination? All those things are important for evaluating people with pituitary tumors because it turns out that the gland secretes hormones that control all those bodily functions. In addition, it's important to get a history of, is someone excessively fatigued? Do they have muscle and joint pain? Have their facial features changed slowly over the years so that to them it seems unnoticeable, but when they come in and they actually show us a picture of them 10 years ago, there's a stark difference, and we can tell that it's likely because they are secreting something from a pituitary tumor. So it's absolutely critical if you suspect that someone potentially has a pituitary tumor that they be evaluated with state-of-the-art medical imaging.
Different types of imaging studies can be used. The first type is a CAT scan, which is kind of the first step exam that we often do. It's done often in the acute setting when the patient just had the first few symptoms from the brain tumor, and we do the CAT scan just to kind of get an idea of what's going on. Where, is there a brain tumor? Where is it located? Did it bleed? That kind of things. And then typically the next set of exam that we get is an MRI scan where we can get much more information about the type of brain tumor, about its location, its relationship to important structures that the surgeon will need to know when they do their surgery. And we can also get some what we call functional information about the tumor and the normal brain tissue around the tumor.
We have both the medical endocrinologist as well as a surgeon evaluate every patient. And that's important because there are many lesions, tumors in the pituitary gland that don't require any surgical therapy or any intervention whatsoever. There are many patients who have a lesion that was found incidentally, and they just need to be watched. There's some people who do have pituitary gland tumors that are best treated with medical therapy. It does turn out that there are many patients who have pituitary tumors who need them to be removed for a variety of reasons. The nice thing about surgical intervention is that our technology has advanced to the point that we can now do this with minimally invasive techniques. And so the standard would be what's called an endoscopic transnasal transsphenoidal resection. And essentially what that means is that a small fiber optic tube about the size of a pencil tip, about 2 to 3 millimeters, with a camera mounted on the back, is inserted through the nostril all the way to the back of the nasal cavity. We can then use a series of small micro instruments to remove just a small window of bone, no more than 2 or 3 centimeters. It places us right inside an air-filled sinus called the sphenoid sinus, which sits right in front of the sella, which is the bony recess in the skull where the pituitary sits. And in this case, someone has a pituitary tumor that's expanding that sella and causing problems. Using that endoscope and those tools, we can then selectively remove the tumor and try to maintain the normal gland in its normal consistency, and avoid all the other critical structures, which include the optic nerve, the chiasm, and the carotid arteries. For people who need this, removal of a benign tumor that typically grows slowly is often a cure. So it turns out that there are some instances where tumors either invade other areas around the arteries or nerves that control eye movements, where it's very difficult to completely remove the tumor, or else it encounters too much risk. And in those instances, again, typically because these are benign tumors, we can selectively remove the portion of the tumor that's causing visual loss, and then treat the rest with focused high-dose radiation.
So radiation therapy is a way of using electromagnetic radiation, usually X-rays and sometimes other forms of radiation like protons, in order to kill tumor cells. Patients can be treated with a more focused type of radiation we call stereotactic radiosurgery. Stereotactic radiosurgery can be divided in usually treatment times that are between 1 day and 5 days. Patients with stereotactic radiation treatments usually have smaller tumors that are amenable to this type of technique.
For one of the most common types of secreting pituitary tumors, a prolactin secreting tumor, the standard of care is actually medical therapy. Giving those medications can essentially eat away the tumor and cause it to resolve completely. Sometimes it means those patients need to be on therapy lifelong, but again, in certain instances, that is definitely the standard of care. The vast majority of people tolerate these agents quite well, but it is true that there are some patients who don't tolerate it. Either they feel fatigued, they have nausea. Some patients with a psychiatric history can't tolerate these agents because they have other effects on other parts of the brain. And in those instances, that's a case where surgical intervention for someone with a tumor that's typically treated medically actually has an important role. There are other times where secreting tumors, such as the ACTH secreting tumor or growth hormone secreting tumor, where it invades other structures that are not accessible surgically, or even after removal of most of the tumor is obtained, there are some newer drugs that can be used to help control the symptoms that result from the oversecretion of those hormones. It is so satisfying to see someone who basically comes in with a lot of anxiety, possibly vision loss, possibly many other endocrinologic symptoms, who we can take to the OR and in a matter of a few hours, remove the offending lesion and have them walk out of the hospital the next day or the day after, essentially normal, with no scar, oftentimes with restored vision and normal endocrinologic status.
Once you're properly diagnosed, you have proper imaging, your body is very quick it can be very resilient. This living organism that can just adapt and things will always get better, but it just takes some time.